Late Night Health continues as we focus on autism with Dr. Paul Corona, the author of Healing the Mind and Body. It's a trilogy. It's something that both doctors and families should have on their bookshelf. And it's something to be used, to be looked at. I've been looking at it on over the last week or so, reading about autism and then some other disorders, attention deficit and attention deficit hyperactivity disorder. Is that what ADHD is?
Right, exactly.
Yeah. And we're discussing that. You know, the controversy in treating these disorders with chemicals or drugs, pharmaceuticals, is reaching fever pitch, okay? So why should I treat my child with drugs rather than trying natural, in quotes, natural methods?
Well, you know, and natural methods can work. Why? Because of the fact that it brings out the potential of that child. Because on average, kids and adults who have ADHD are actually more intelligent than people who don't have it, on average. So it's typically not an intelligence problem. It's a problem with taking that intelligence and be able to actually doing tasks and finishing projects and reading and as adults doing paperwork and doing things like this. And so if you don't treat a child or a teenager, it could lead to potential lower self-esteem because they say, I feel stupid, how come I can't do this? So that we have to really worry about kids and their self-esteem, which can affect them all throughout their life, especially moving into the teenage years. So that's one reason. And also just bringing out the potential, because I see it all the time where kids who are very bright and they're doing C's, D's, and F's, and all of a sudden you treat them and they're getting A's and B's, and they were never able to do that before.
But are drugs a secondary method of approaching the disorder, or do you believe that should be the primary focus?
Well, I mean, there's other behavioral things. In other words, with kids, you put them in front of the class so they're not distracted in the back of the class as much, and they're going to see the teacher. I mean, so there's ways of doing things behaviorally to try to help. There's no question. Being in an area that's quieter when they're doing homework, without distractions. So there's a lot of other things you can do. And again, you don't have to treat it. People who don't treat it can still be pretty successful. However, treating it, I think it should be more primary because of the fact that treating this makes such a difference in people's lives that suffer with this. They're, is able to achieve things that they were not able to do previously.
Using pharmaceuticals.
Pharmaceuticals, yes. I mean, there's natural products out there, but again, the natural products are typically at the health food store at Costco are basically variations of stimulants. They're basically just natural stimulants. So stimulants seem to be the key treatment for ADD, and it seems counterintuitive because people think, well, some of these kids are so hyperactive, if you give them a stimulant, isn't going to make them worse. Actually, no. Actually has very much of a calming effect on the system. And with autism in particular, because that is our focus as we're talking about the film Bass Clef Bliss. We'll be talking over the next couple of weeks. Actually, we'll be speaking with with Terrence, who is featured in the film. He's 22 years old and wants to be a recording engineer. He is a fabulous musician. We've had the opportunity to talk with Terrence and his mother and the director of the film over the last couple of weeks, and we'll continue for a couple of weeks more as we celebrate Autism Awareness Month. How do these drugs work with autistic kids? Does it work in the same way? It works in the same way because now this is if the autistic kids have ADHD, which a high percentage of them do, and people with autism are already have another big strike against them because they have a lot of problem with social skills, socialization, communication, a maturity level, oftentimes
and focusing as well.
focusing as well. Yeah.
Next week, let's talk about ADHD and ADD on the program, and let's talk about it not only for kids but for adults, because I have a theory on that, and we'll talk about that next week. In the meantime, you can go to drpaulcorona.com at drpaulcoronamd.com, drpaulcoronamd.com, or visit us at latenighthealth.com. More coming up on the second hour of our show. You can join us for that if you don't get it on your local radio station at latenighthealth.com. I'm Mark Alyn. More coming up. Don't go away.